Thank you, Senator Murkowski. Senator Baldwin.
Thank you, Mr. Chairman. As much as we disagree on things, I just want to note the underlying agreement that this system needs a lot of reform. And Mr. Chairman, you opened up with saying we have 3 weeks. We have 12 days. That's how long we have until open enrollment closes. And obviously, we could take some future action to extend open enrollment. This is something, there's an immediate issue, and then, of course, there's a lot of agreement on the structural and systemic problems in our healthcare system. I want to make a point that just under 50% of Americans get their health insurance through employers or group insurance. 20% are on Medicaid, 15% on Medicare, 1% on TRICARE or VA, and just over 6% are in this market. There are problems with this market, but I have to say that abandoning the ACA by getting rid of these, and trying to overturn it or destruct it is not going to solve the system as a whole. And many of our experts here, talked about some of the problems of consolidation, of the pervasive role of middlemen in the healthcare system, addressing private equity in healthcare. And part of the pursuit of solutions there will involve much greater visibility on what's happening behind the curtain. Transparency efforts, and I know there's bipartisan agreements on a number of them, will inform this committee in major ways of what we need to do to extract reforms and make sure that this isn't just a profit-motivated system, but is in fact focused on patients and the well-being of Americans. But the solution is not to let these enhanced tax credits expire. We've got to buy ourselves time to do these larger reforms. What allowing the Affordable Care Act tax credits to expire will do is move people who are currently the 6% of Americans who currently buy their insurance in the individual market, they'll become uninsured or go for junk plans. We can talk about that later. But the Affordable Care Act, with all its flaws, requires that health insurance plans cover a wide range of preventative services at no cost to the patient. So no matter how big your deductible is, your preventative care is covered under the ACA. A lot of the Wisconsinites that I've been talking to who are lamenting the fact that their premiums are doubling, tripling, quadrupling, are saying, I get it for the preventative care that I can provide my entire family before dipping into the deductible. And then it is a medical bankruptcy prevention insurance. Right?
Maybe.
It means that if you have a $10,000 deductible, but you have a crisis, an injury, an accident, an illness that costs more than that, you won't lose everything. We can definitely improve the ACA. We can improve the entire system. But the solution is not to let 4 million people not be able to afford it anymore. And so we must figure out a way to extend the Affordable Care Act tax credits to allow our committee, the minds in this room, to work on structural and systemic reforms. Dr. Fegan, why is it so important that we extend the enhanced premium tax credits as soon as possible, given there's 12 days left of
Right, because people are making those decisions now about whether or not they should keep their health insurance because they realize, we have to recognize that this is a huge financial burden on the household, and people are making decisions that maybe I should go without health insurance. It's a huge problem for working class people because it allowed people who otherwise wouldn't have insurance to have insurance. And to the idea that they're going to go without, you can't predict when you're going to have, you feel tired and an abnormal blood test shows you have leukemia. You can't predict when you're going to be in an automobile accident. And to subject working people to that stress, in addition to everything else that's going on in the country today, is frightening.
Thank you, Senator Baldwin.